I'm Dr. Laura Vasquez from Central Texas Veterinary Emergency and Specialty Hospital in Austin, Texas. And I'll be answering some questions today that clients have wondered about regarding intervertebral disc disease. My assistant Dennis will be helping me by asking those questions.
Dr. Vasquez, are some dog breeds prone to intervertebral disc disease?
Any dog can get intervertebral disc disease, but there are some breeds that are predisposed. The most commonly affected dogs are what we call chondrodystrophic breeds. And so I basically like to think of those as the ones that kind of are low to the ground with short, stubby little legs. The dachshunds, beagles, the mini poodles, Lhasa Apsos, Shih Tzus, some of those are the common breeds. They tend to get it commonly before the age of 6, but it's not to say they don't get it when they're older. But we do see it in other breeds of dogs like Labradors and Pit Bulls.
What are the signs and symptoms of spinal disc problems in dogs?
So it's a wide range when you have disc problems. So the first sign that oftentimes owners note is that they become very painful. And dogs can show pain different ways. Some dogs will cry out and be very vocal. Some dogs will kind of hide and not want to be very interactive with their families. And then when they actually start to have actual neurological issues, they'll kind of develop what's called ataxia, which some owners describe as a drunken wobbly gait. It can affect just the back legs, it can affect all 4 legs, and then that can progress to trouble walking, weakness, trouble standing. Then it can get worse, they can become paralyzed, and the worst kind of injury is to become paralyzed and lose feeling in your toes or your tail.
Dr. Vasquez, how is IVDD, intervertebral disc disease, in dogs diagnosed?
So intervertebral disc disease is a diagnosis of diagnostic imaging. So we start off by doing spinal radiographs, commonly called x-rays, and then after that we can do either CT scans or MRIs. There's also a different way to diagnose it, doing what's called a myelogram, which is a special type of x-ray with contrast.
What are the treatment options for dogs with IVDD?
So there are 2 treatment options. You can go the medical management route, which involves activity restriction, anti-inflammatories, and pain medications. Or if it's a really bad case where, let's say, your pet is paralyzed or can't really use its legs, then that's when we think about doing surgery. And so surgery involves going in there and decompressing the spine, the spinal cord, and removing that offensive material that's compressing the spinal cord.
So what are some good exercises that I can do with my dog with IVDD?
So depending on where your dog is in its intervertebral disc disease, if we're in the early stages of diagnosis, we really want to keep them quiet. It's what I call tough love. So even though your pet may feel good after a few days of medications, it's really important that you don't let them run, you don't let them jump, you don't let them roughhouse, you don't let them use stairs, because that disc, the tear in the disc, needs 4 to 6 weeks to heal. So that's probably the most important part of that tough love with medical management. If you're in the period where they're getting better, you can slowly reintroduce activity, short walks, and rehabilitation.
So we'll keep that running. I'll do an edit.
Yeah.
So at the end, when it's the last one, we work out like a hand signal, like that's it or whatever.
Okay.
And then you just wrap it up by repeating, by offering people to, hey, if you still have questions, give us a call. We're happy to see you, or however you want to.
Okay.
So go ahead and just do the wrap up, and I'll cut this whole little
Sure.
section you're talking.
So these are some of the questions we got regarding intervertebral disc disease. If you have any more questions regarding your pet or feel your pet needs to be evaluated, feel free to give us a call and schedule an appointment.
Perfect.
Bam.